Yeah, so idiopathic basically is a term where we use where we don't know what has caused the disease, or yet our science is not that developed enough to identify the cause. But there are certainly different risk factors. And increasing age, most of our patients with IPF are above 60 years old, so we definitely think age is a risk factor. Most of our patients are male, and and about more than a quarter of the patients have had smoking history. So cigarette smoking plays a part in development of, or is thought to be making a part in development of idiopathic pulmonary fibrosis. There are certain other risk factors which includes a familial history. While majority of our cases are sporadic, that is, they do not have any genetic or family history to develop the disease, but 10 to 20% of the patients may have in the future, may get one or two relatives who will also have um, idiopathic pulmonary fibrosis or a fibrotic lung disease, to say the least. But yes, there's definitely a genetic genetic component, and there are two genes, MUC5B gene and TERT gene, TERT and TERC genes, which are thought to play a role. And currently, there are certain ongoing tests which we target at the patient who's suffering himself to see whether they have these genes or not. But majority of the patients, again, in the ongoing studies, up to 75% of the patients, even with familial history, do not test positive. So genes have thought to play a role, and there's definitely a correlation, but we are not at this stage. Otherwise, other risk factors can have a chronic gastric reflux disease is thought to play a role. Exposure to certain environmental exposures like air pollution, radiation, and certain metallic dust are also thought to play a part in development of IPF.